Hi, welcome to this second part in the Jumpstart POCUS series on ultrasound modes. While being able to see real-life dynamic anatomy in POCUS is becoming necessary in 21st century medicine, the additional modes really bring a whole new level of functionality. Not as cool as a tricorder, but amazing nonetheless. So spend the next 5 minutes or so with me as we cover these various modes as well as their clinical applications. The first is motion mode or M mode. We discussed spatial resolution in the last video. There's also temporal resolution, which is more or less the frame rate that the machine is able to process. Imagine this block as the amount of data that you or the machine is able to take in. The x-axis and the y-axis is the scan plane, but the z-axis is time. There's a trade-off between spatial and temporal resolution. For example, this is the cardiac exam right here where you have less resolution devoted to the scan plane, but increased temporal resolution as compared to, let's say, musculoskeletal or small parts presets, which give you better scan plane resolution, but decreased temporal resolution. However, better technology, the limitation is becoming more of our human ability to discern fine movement. So this is where M mode is really helpful because it focuses on one line in the scan plane, but with significantly increased temporal resolution, literally in 1 millisecond intervals. First, how do you use M mode? First, you want to find that M mode button, press it once to get the sampling line right here. Then you want to use this trackpad to center the line on the structure of interest. And by pressing M mode again, you actually start to get the tracing. And you'll want to hit this snowflake button to freeze the image so that you can better assess the tracing in front of you, as well as use the calculations packages and the caliper for measurements. Here are some common examples of clinical applications of M mode. This is diameter change of the inferior vena cava associated with changes in venous return due to the respiratory cycle. The M mode allows you to quantify this change by measuring the maximal diameter here in expiration, as well as the minimal diameter here during inspiration. Fetal heart rate estimation is also an important part in the fetal well-being assessment and can be performed with M mode. The sampling line is placed over the fetal heart, and the tracing of this cardiac motion shows a peak and trough pattern right here. And by using the fetal heart rate calculation tool, you can actually place this interval between two peaks or two troughs, and you get a fetal heart rate. Lastly, in the assessment of pneumothorax, we can use M mode to detect the presence of pleural sliding here. This hyperechoic line is the pleural interface. On this tracing, you'll notice two patterns. The first is when there is no motion, and these are seen as contiguous horizontal lines here, and this represents the chest wall. Below, you'll see motion as seen by this granular appearance, and so this indicates normal pleural sliding and not a pneumothorax where you would have absence of pleural sliding. By the way, students at DGOSOM will learn to perform all these assessments and many more by the end of their second year. Now let's talk about Doppler capabilities of your POCUS machine. First, a review of the Doppler Shift. A sound wave that hits a moving particle like a red blood cell will echo back at a slightly increased or decreased frequency. This Doppler frequency shift is an increase here, resulting in a shorter wavelength here when the red blood cell is moving towards the probe. When the cells are moving away from the probe, as in this case right here, the shift is decreased and you have a longer wavelength. Now this can be displayed on the machine in a qualitative manner to allow for localization of flow in a scan plane, for example, or it can be used to estimate precise velocities in quantitative or spectral Doppler. So how do you use color or quantitative Doppler? On both machines, pushing the C button here and here will give you the color or qualitative form of Doppler, while pushing the D button here or here will give you the quantitative version or spectral version of Doppler. Within both modes, you can use the trackpad here or the touchscreen here to align the sampling box or the sampling gate. Now there are two types of qualitative or color Doppler. The first reveals both directionality and velocity range of flow. Right here, The mnemonic BART not for Bay Area rapid transit, but for blue away, red towards is a way to remember that flow going towards the probe is going to be red, whereas flow going away from the probe is going to be blue. These are actually renal vessels. The renal arteries are going towards the periphery, whereas the renal veins are actually going away towards the center. And you can see this here too. The red indicates that flow is going towards the probe, whereas blue is going away. And these are the velocity ranges. You can actually toggle them between low, medium, high sensitivity to detect different ranges of flow. Now, color power Doppler is a little bit different. It does not assess for directionality or general velocity. Instead, the intensity of this orange spectrum is related to the number of moving particles or cells. So even if a few RBCs are bouncing along at a few centimeters per second, CPD or color power Doppler will be able to detect them, whereas standard color may not. Now, these are examples of quantitative or spectral Doppler. Here you get like a tracing of actual blood flow over time. In this first example is pulse wave Doppler, which is used for normal blood flow. And the ranges of flow go from about 20 to 200 centimeters per second. You can adjust the sampling gate where the pulse sound waves are sent right here. And this is an example of the reflected echo, which shows a normal triphasic flow of an artery with systolic ejection peak, early diastolic flow reversal, as well as forward diastolic flow. This second example is of continuous wave Doppler. This is slightly different from pulse wave Doppler in that a portion of the ultrasound probe is constantly emitting sound waves, while another portion of the probe is constantly listening. The main advantage is that you can actually estimate velocities at a much higher range, about 10 meters per second, or 5 times the amount of normal pulse wave Doppler. Pulse wave Doppler, on the other hand, is able to estimate velocity at a precise point like right here, because the pulses are timed to allow for the echoes to return. However, because continuous waves are emitted in continuous wave Doppler, you can only estimate the range of velocities along this line and not a particular point. This is not really a significant limitation because we're often looking for very abnormal acceleration or increases of flow that is seen in valvular or vessel stenosis or regurgitation. The last example of quantitative or spectral Doppler is tissue Doppler imaging, or TDI. This is really a form of pulse wave Doppler to assess for cardiac muscle movement, which moves typically below 20 centimeters per second. So first, the sensitivity is increased to detect this low velocity range right here. The gain is also significantly reduced so that flow from less dense blood cells is not detected, and only movement from the denser muscle is detected. TDI has significant applications in both heart failure and many cardiomyopathies. While many of these modes, especially spectral or quantitative Doppler, are for more advanced applications, there are really many applications and calculations that are used on a daily basis in POCUS. For example, in paracentesis, we want to avoid subcutaneous vessels because most of our patients are coagulopathic. And here you could see that you can demonstrate a vessel at this point, so we want to avoid this point of entry. Now, for patients that come in with obstructive neuropathy or lumbar myelopathy, we typically want to see if there's any evidence of urinary retention, and for that we can calculate a bladder post-void residual volume. Now, the last example is when we are unable to palpate a pulse, either due to trauma or a peripheral arterial disease, or even an embolism. And this is where using color Doppler alone is able to actually detect presence of blood flow. My advice is that you take the time to explore the different calculations and modes available. Really, the more you learn and practice, the more you'll realize the amazing capabilities with POCUS. With that, thank you for watching this video. Go out and practice, and if you have time, watch the next video on common ultrasound artifacts.